Welcome to the Human Capital Innovations Podcast, your go-to source for personal, professional, and organizational growth and development. We hope you tune in often for all things people management, organizational development and change, organizational leadership, and social impact related. Maximize your personal and organizational potential with Human Capital Innovations Podcast. Welcome to the Human Capital Innovations Podcast. In this HCI Podcast episode, I wrap up Season 2 of the podcast, reminiscing a bit on where we've come from, how we've gotten here, and what we've accomplished over the first 2 seasons. I also share an update about my personal health and how my family is dealing with the COVID pandemic. As we finish off Season 2 of the Human Capital Innovations Podcast, I just thought I would recap on where we're at up to this point in the podcast, as well as share a bit about my personal situation related to the COVID pandemic. I'm really pleased with how things have gone with the podcast to date. I've been fortunate enough to have the opportunity to talk with a couple dozen experts in various areas of HR, leadership, organizational development and change, social impact, and related areas to discuss their takes on organizational health and effectively leading and managing people within organizations. It's truly been a pleasure to talk with these professionals, these experts, these individuals that have so many wonderful insights. And it's enriched me to have the chance to talk with them, to learn from them, and along with them as we have meaningful discussions. I'm really excited for what's in store for the podcast. Coming in Season 3 are some really great interviews with some industry-leading professionals. And I'm very excited to have the chance to talk with them and continue to grow the audience of the Human Capital Innovations Podcast. Now, I just wanted to take a few minutes and update you on my personal and family situation as it relates to the COVID pandemic. On Thursday, I woke up early as normal and started about my day. And then around 9 a.m., it's like I just hit a brick wall. It just knocked me on the floor. Literally, I was laying on the floor. So nauseous, body aches all over. My chest was hurting. After the initial wave of nausea passed, I retreated to my bedroom, canceled all of my meetings and everything work-related for the rest of the day. I tried to get some rest. I took some ibuprofen and just tried to deal with the severe body aches and the chest pains and what I was dealing with. By early afternoon, I had an appointment scheduled to get tested for COVID. And so my wife drove me to the nearby hospital. Of course, we were wearing masks. And I had the distinct pleasure of having the brain swab shoved up my nostril. That was not pleasant. They then told me that it would be 72 hours to get the results back, which was frustrating because I figured I didn't actually have COVID. I probably just had some sort of a flu bug. We've been exceptionally careful in our household. I have 6 young children. We haven't had any play dates or let anyone play with their friends in the last 2.5 months. We only leave the house for important errands where we can't have things delivered. The number of times we've left the house to go to a store, I could count on one hand over the past 2.5 months. We have groceries delivered. We have food delivered through DoorDash. We're doing social distancing, always wearing masks when we're out. Every precaution that we've been instructed to take, we've taken. And I just figured, how in the world? I just haven't even been around people. How would I have gotten this? For that matter, I was wondering how would I have gotten any flu, but maybe I was just in denial, but I didn't think I had COVID. And so a 72-hour wait period for the results was frustrating because I knew I'd have to be isolated from the rest of my family during that time. Hopefully, getting a negative result would then allow me to just rejoin the family. Well, I was quite surprised, but by Friday morning, I had my test results. They got those done really fast, and unfortunately, I tested positive. So what does that mean for us? Unfortunately, that means I continue to be quarantined from the rest of my family. But instead of just 72 hours until I could confirm that I didn't have COVID, now that I'm the only one with symptoms, I have to isolate for 14 days, which is already driving me crazy. So I am on the start of day 3 of isolation in my bedroom. I do have a workspace. I have a table and a laptop. I have my tablet and cell phone. I have some books. I have a harmonica. I have some things to try to keep me occupied and busy. But really, it's already been quite frustrating to be stuck in my bedroom while my wife has to take care of everything else with the 6 children outside of the bedroom. So that is the process of testing positive for COVID. I'm happy to report that health-wise, I feel better than I did on Thursday. It really knocked me down. It was intense for that first day. By the second day, though, the fever had gone, so that made a big difference. I still have chest pains, I still have body aches, but I don't have the fever, I don't have the nausea, so that's good. But the aches and chest pains persist, but I've been able to get a lot of work done. I still had some meetings yesterday. I've been working on projects and papers and various work, mostly like normal. I'm of the mentality that normally if I'm in a situation where I can make sure that I'm not putting others' health at risk, I will continue working even when I'm sick. So this kind of a situation where everyone's working from home is actually perfect for me because I can still get a lot done as long as I'm well enough to continue to work. So I don't want to be too self-indulgent, but I just wanted to share a little bit about my situation because it's finally hit home. I've known some people who had COVID, but it hasn't touched our family yet. And like I said, we've been so careful. We've been so strict in the social distancing precautions and in cleaning the house and washing our hands and wearing masks and everything. But unfortunately, it still hit our family. And we fully expect, even though I'm self-isolating, that there's a pretty good chance for the other family members to catch it. We hope that we isolated me in time, but we'll just have to wait and see. So that's where we're at. Now, I wanted to spin this a little bit towards virtual labor and work, since that's really the topic for this podcast. I have to say that I am grateful that I have the opportunity to continue to work and that there are virtual and remote work technologies available that allow me to continue to have meetings and to do the important work that needs to be done. It brings to mind the shifting nature of work overall, and how we've seen organizations move more and more towards virtual labor over the last decade. And I'm of the firm belief that this global pandemic is just accelerating that movement, that once we come out of this, that we'll still see many people working remotely, working from home, and taking advantage increasingly of virtual options to connect. As an academic practitioner, I'm involved in both consulting but also in academia and research conferences and such. So, for example, in the world of academia, we have lots of conferences. We go to conferences, we make scholarly presentations. I do this often. And I often will fly across the world to different locations to make these presentations. And it's always bittersweet because I like to travel. I like the adventure. I also like going to conferences, connecting with colleagues, sharing my research. But the bitter of it is then I have to travel. I have to leave my family. And it, depending on where I'm going, it can take a long time. So not only am I gone for the duration of the conference, but I have to include travel days, and it's hard. And I have to admit, I've really enjoyed over the last couple of months being involved in virtual conferences where we're still meeting with other academics, other experts across the world, sharing our research with each other, but we're doing it all virtually over Zoom or team meetings or any of these technologies. And I don't have to travel. I don't have to spend days just getting to where I'm going. And so that's actually been quite nice. In addition to all of the other ways that virtual work provides a lot of convenience. So I don't see organizations just going back to the way it was. I think even when people work together physically in a physical location, I believe that organizations will take greater advantage of virtual meeting options when it comes to things like conferences, when it comes to things like meeting with boards and other advisory councils and things like that. It is a huge cost savings to use virtual means to connect. And I think having us all being forced to do so now will get some people over the hump of accepting and adjusting to these new technologies. And I believe that ultimately, many organizations and many individuals' preferences will simply be to continue the virtual and flexible type of work that has occurred during this pandemic. Now, specifically related to me, on the academic side of the house, I work at a university, and I thought I would mention just briefly about how the university has responded, how administration has responded to the COVID pandemic. I'm not going to get into dealing with students and classes. That's an entirely different topic, though it's interesting. But I thought I would just briefly talk about their approach to dealing with the administration, the staff, the faculty, all of the employees of the university. I have to admit that I'm very grateful that overall I feel like they've done a wonderful job of thoughtfully exploring the issues related around the pandemic, the health issues, the mental health issues, the economic issues, all of the intersecting pieces and the impacts of what this will all mean for us at the university. Since the middle of March, we've been working from home. So I have not actually set foot on university campus physically since mid-March. I finished teaching my classes online for the rest of the semester. I've continued to have lots and lots of meetings, but they've all been done virtually. And the university administration has done a really good job of facilitating virtual work and helping to maintain the opportunity for work and the jobs of the university employees. So I'm appreciative to them of that. That said, of course, there have been hiccups, and it hasn't been perfect. I wouldn't expect it to be perfect, of course. There's been challenges with the communication of processes and procedures and the interpretation of policy as it pertains to employees working virtually. It's been a challenge, and at times there's been frustrations that people have had, and I suspect that's the way it is at pretty much every organization. But I, again, am very appreciative that they have clearly been making a concerted, thoughtful effort to be mindful of the needs of their employees. And I think that's ultimately all that any employee can ask of their organizational leadership. So I'm grateful. I'm grateful to have a job where I can continue to be employed and get a paycheck even while I'm testing positive for COVID. While I can still do the work that needs to be done, but that I have people who are sensitive enough to understand that perhaps meetings will have to be canceled or postponed, and that people will be accommodating of me. On Thursday, when I had to cancel a bunch of meetings, some of those were university related, others were consulting related cancellations. But everyone was super kind and accommodating, and I, of course, explained why. And coming back to the university, I'm appreciative of those that I work with, that they were so willing to be understanding of my situation, my family's situation, the challenges of working at home while helping school 6 children, working from home while testing positive for COVID, and just everything that goes with it. All of the uncertainty, all of the fear, all of the anxieties and stress. It's all very palpable right now. And I know that despite the challenges, I'm incredibly fortunate. And there are many that simply haven't had the same opportunities with their own employment that I have. So I'm grateful for that. With all of that said, again, I don't want to be too self-indulgent, but I thought I would just close out season 2 of the podcast by sharing my current situation. I hope to continue with the work. Of course, part of that just depends on my health, and we'll see how the virus affects me in the coming days and weeks. Also, how it spreads or doesn't spread to the rest of my family. So we'll just have to play all of that by ear. I am excited to make some announcements in the near future about future guests of the podcast in season 3. I think you'll be pleased to see the lineup and to have the chance to listen to some of these amazing thinkers, gurus, and thought leaders in the HR leadership and organizational development and change space. Thanks. I hope that you will all stay healthy and safe and be happy and productive amidst all the challenges we're currently facing. Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe and that you have a great week.